You're thinking about having LASIK, but you're not sure if it's a good idea. Rather than searching online or asking family or friends who are not experts in the area, you might be interested to hear what an eye doctor thinks about your unique situation. Hi, I'm Dr. Jennifer Wan, an optometrist of over a decade's practice experience and the owner of my own one-stop eye care practice, Ardent Vision Eyecare, in Toronto, Canada. I'll start off with a big disclaimer that no one can decide for you. My goal today is to offer a perspective, albeit a professional one that is based on years of practice in the field. For me, when it comes to considering LASIK or a vision correction procedure for a healthy individual, there are two factors to look at: age and prescription. The following is me speaking my thoughts out loud. If I was 20 years old or less, I wouldn't do it yet. Being young, my eyeglass prescription is possibly still changing. Most adolescents see their prescription increase slowing down and eventually stabilizing in their late teens and early 20s. So personally, not only would I want to be at least 20 years old or older, I would want to have seen that my prescription has not changed for at least a few years as a basic criteria before I consider LASIK. If I were in my early 20s and mid-30s and my prescription has stabilized for at least a few years, I would consider vision correction if my prescription bothers me. By my prescription being bothersome, I mean I wouldn't be comfortable most days to go without corrective lenses to help me see clearer. The way I look at it is I can walk with a crutch, or there's a procedure that would allow me to walk without a crutch. Would I want that? Personally, for me, the answer is yes. If I were in my late 30s and into my 50s, the decision becomes a little more complex. This is because something called presbyopia, or the decline of our eye's focusing system, starts to kick in for most of us in our early to mid 40s. Traditional vision correction procedures aim to correct our distance vision. In order to bring that clear distance viewing to focus at near, we need our inbuilt focusing system to be working and intact. At this point, if I'm on the brink of or already suffering from presbyopia, whether or not I would consider vision correction would heavily depend on how high my eyeglass prescription is. If my prescription was -3 or less, this is just me, but I probably wouldn't proceed with vision correction. This is because having a low amount of nearsightedness is like having inbuilt reading glasses. I might need glasses for distance viewing, but the moment I take off my glasses, things look clear and comfortable at near. So when I spend thousands of dollars to get rid of the need of corrective lenses for distance viewing, only to expect reading glasses for near? Again, personally, the answer for me would be no. To be fair, I did once have a 40-year-old patient who was a triathlon athlete who treasured clear distance vision more so than near, and they thought that trade-off was worthwhile. If I had a prescription of -4 and above with a higher prescription and am in my late 30s and into my 50s, I would still explore vision correction because of the above reasons. Having a moderate to higher nearsightedness prescription means that I do have to hold things rather close to my face in order to see clearly at near without my glasses on. For those who choose to wear eyeglasses to correct their vision, having a higher nearsightedness prescription means that your eyes will be considerably minified behind the eyeglasses. Your frame choices will be limited because larger frames will show the lens thickness. Not to mention, you will always have to pay a premium cost to thin out your lenses so they won't weigh down so much on your face. If you wear contact lenses, you might have to deal with dry eyes, infections, and your options will also be limited once your prescription is higher, especially with a high astigmatism prescription, and you want a multifocal contact lens option. Now, instead of just looking at candidacy for LASIK, I would also explore ICL, otherwise known as implantable Collamer lens. This is because even though it does have a higher price tag, it may reduce the risk of LASIK-induced dry eyes. If you want to learn more about that procedure, you can watch my last video, which I'll link right up there. Now, your question might be, do I walk the talk? Yes. I was a -4 myope, and right at the dawn of graduating optometry school in my mid-20s, I had laser vision correction, and I have not looked back since. If what I just laid out still does not capture your situation because there are so many unique cases out there, or if you're remotely interested in the idea of having LASIK or a vision correction procedure, the first step would be to schedule a comprehensive eye exam with your optometrist and ask them to refer you for a free consultation. This will at least let you know if you're indeed a candidate or not. If this video helped you gain perspective on deciding whether to go ahead with vision correction or not, please like this video to show your support. Subscribe for more free eye health videos and hit the bell so you'll be the first one to know about the next one out. I'll see you in the next one. Bye!